So talk to me about like how exactly does ozone therapy help with people with like, diabetic ulcers or obviously like for example cancers. It improves the quality of life in which way exactly?
Well, in the context of like diabetic ulcers, so that's like you have a non-healing wound essentially. So there's a wound there that isn't healing up, and the body's not taking care of. It's not using its normal responses to heal that area. And so in that it interacts differently based on the tissue that it's applied to. So if we're applying it into the skin, it's going to be different than if there's an intravenous therapy. So that's where they take some blood out and they mix it with the gas and then they put it back in. They have different reactions and different mechanisms. But in the
Okay.
case of a diabetic ulcer, they can put a bag around the area and infuse this gas into the bag. And that's essentially going to do a couple things. It's going to stimulate healing by stimulating growth factor and circulation to the area and that kind of thing. And then the second thing is if there's any sort of like pathogen or infection that's slowing the healing or preventing it from really healing up, it'll also eliminate that infection. In the case of like cancer, it's not like it's attacking the cancer. So I don't want to give like anybody false hope in that regard.
Right.
But it greatly helps with quality of life. So they do an IV of ozone therapy. And if somebody is undergoing chemo or even just has cancer and they're not doing chemo, but in the case specifically of chemo, there's studies where they're showing around a 70% improvement in quality of life metrics, including like sleep and brain fog and pain, nausea, hair loss, like all that kind of stuff. So it's
Mm-hmm.
kind of cool. And that's a really simple treatment that's not going to negate the effect that you want from the chemotherapy,
Mm-hmm.
but it's going to greatly improve the overall quality of life in that